Breast cancer, which is said to affect 1 in 9 people. In fact, among all cancers affecting women, breast cancer has the highest number of cases. It's not just a concern for women. Recently, Brother Corn from the Bubblegum Brothers was in the news. At the age of 67, he announced on his social media that he, as a man, had developed breast cancer. But don't worry, compared to other cancers, breast cancer often develops near the surface of the body. It can sometimes be found through self-checks. When it comes to breast cancer, if it's discovered late and found at stage 4, the 5-year survival rate is said to be 33.8%. However, at stage 1, if it can be detected early, the 5-year survival rate is said to be 97.1%. If it's detected early and surgery is performed, and hormone therapy is performed, it is one of the cancers that can be treated. So this time, I'll talk about the early symptoms of breast cancer that you'll regret missing, and also how to do a self-check. And finally, I'll talk about breast cancer screening, which is also recommended by the Ministry of Health, Labor and Welfare. It has reduced the mortality rate by as much as 32%. I will introduce these methods, and at the end of the video, I'll talk about ways to lower your risk and help prevent breast cancer. I'll also introduce dietary methods and exercise routines, so please look forward to it. Like this. On YouTube Medical University, we will clearly and accurately share preventive medicine information that you can use starting today, so I'd be happy if you subscribe to the channel so you don't miss any new videos. Now, first let me introduce the early symptoms of breast cancer that are dangerous if overlooked. Here are 5 early symptoms of breast cancer that are dangerous if missed. The first is a lump in the breast. Why? The reason I explain this first is because 90% of people who discover breast cancer during a self-exam of the breast find it due to a lump, making it the most common symptom. However, what you need to be careful about is that just because you feel a lump, it doesn't necessarily mean it's breast cancer. In fact, according to the data, among people under 60 who went to see a doctor because they felt a lump in their breast, less than 10% were actually diagnosed with breast cancer. So if you find a lump in your breast, don't lose hope and think, it's already breast cancer, so I should give up. Instead, remember that being diagnosed with breast cancer, the probability is not very high, but the most common sign that leads people to notice breast cancer is a lump in the breast. So if you find one, please consult your regular doctor, or if there's a breast clinic or breast surgery specialist nearby, talk to them. It's dangerous to overlook. 5 early symptoms of breast cancer. The second one is abnormal nipple discharge. The kanji might look confusing, but to put it simply, if you notice a red liquid that looks like blood or a yellowish fluid called exudate coming from the nipple area of your breast, in other words from your nipple, you should be suspicious. Of course, this symptom can also occur with conditions other than breast cancer, such as mastitis. When should you be more concerned about the possibility of breast cancer? You should pay attention if it happens on only one side. It's hard to notice if the amount is small, so make sure to check. One way to check is to see if there are any stains on the inside of your bra when you take it off, or when you take off your pajamas in the morning. Check if there are any stains on your clothes when you take them off in the morning. If you make it a habit to check these things as part of your daily routine, you might be able to detect problems early. Here are 5 early symptoms of breast cancer that are dangerous if missed. The third one is a dimple in the breast. Please take a look at this image. It's a little hard to see because it's zoomed in, but can you notice the slight dimple? Even if there's a dimple in the breast, many people don't notice it unless they look carefully. The best way to check is to compare both sides in front of a mirror. Breast cancer is more likely to develop on one side rather than both sides at the same time. Please compare both sides and see if there are any changes in shape. I think it's good to have a habit of checking even once a month. For example, you can compare both sides when removing body hair or when applying body cream. If you make it a part of your daily routine, it might be beneficial in the future. Here are 5 early symptoms of breast cancer that are dangerous to miss. The fourth one is irregular menstruation. Actually, recent studies have shown that some types of breast cancer are related to female hormones. Because of these effects, even now, for those who still have their periods, if you usually have your period about once a month but suddenly there's an unusually long gap, or your period comes earlier than a month, such changes could also be a sign of breast cancer. Of course, irregular menstruation can also be caused by ovarian problems, stress, or malnutrition when you're not getting enough nutrients, so please remember that having this symptom doesn't necessarily mean you have breast cancer. Early symptoms of breast cancer that are dangerous to miss. Top 5. The fifth one is swelling under the armpit. In addition to arteries and veins, our bodies also have lymph flowing through them. Lymph is a pathway throughout the body where waste products, immune cells, and cells that fight bacteria flow. Along these pathways, there are lymph nodes, which act like checkpoints located in various parts of the body. One of these is the axillary lymph node, and under our armpits there are small lumps called lymph nodes that are usually less than a centimeter in size. Actually, they are there, but since they are not swollen under normal circumstances, it's hard to feel them even if you try. However, if you develop breast cancer, cancer cells can travel through the lymph fluid, causing an immune reaction here, and the lymph nodes in the armpit area may swell. Specifically, the area is right around the chest side of the armpit. Please try to massage upward along the pectoral muscle where the muscle is located like this. When you check like this, if you feel a hard, lumpy area or something that is clearly a hard lump, it could be a sign that breast cancer has spread to the lymph nodes. So, when you check your breasts daily, I recommend making it a habit to also check your armpits. In addition, regarding the early symptoms of breast cancer, some other videos mention pain as a symptom, but in fact, breast cancer usually does not cause pain. It's actually considered a characteristic of breast cancer. If you have pain in your breast, it's more likely to be something like mastitis or another condition. Less than 1% of people who visit the hospital complaining of breast pain are actually diagnosed with breast cancer. So please don't misunderstand and think, I'm safe because I don't have any pain. Now, with that in mind, how can you detect the early symptoms at an early stage? Let me introduce you to the methods of self-check. One method of self-check, which started being talked about in the United Kingdom in the 1990s, is called breast awareness. It means you should pay attention to any changes in your breasts. If you can notice even small changes in your breasts through daily self-checks, you can detect breast cancer early, start treatment early, and lower the mortality rate. That's why this is getting attention. As a recommended method, you should check your breasts at least once a month. That being said, it can be hard to make time for a special check when you're busy. It's hard to make time in your daily life. So for example, when you put cream on your face after taking a bath or when you apply body cream, make it a habit to do this once a month and use that time to touch your own breasts. When touching, don't pinch or squeeze hard, but rather gently stroke the entire area in a circular motion, keeping your hand on your breast the whole time. If you notice any kind of lump or a dimple like a dent, if you notice any discharge coming from the nipple or areola, or if the skin around the areola is irritated, please check for these kinds of changes. One way to do this is to raise your arm, which makes it easier to touch the area under your arm and lifts the breast so you can check it more easily. So please give it a try. As for the timing of self-checks, about that. For women, the mammary gland tissue develops before menstruation, so some people may feel pain just by touching it, or the mammary glands may feel like lumps, which can be confusing. Therefore, please try to make it a habit to do self-checks after your period ends. Now let's review the first lesson. If you miss it, you'll regret it. As early symptoms of breast cancer, I introduce features such as lumps in the breast, abnormal discharge from the nipple, dimpling in the breast like a dimple, irregular menstruation, and swelling of the lymph nodes under the armpit. As a point of caution, the most common sign that leads to the discovery of breast cancer is a lump in the breast, accounting for 90% of cases. However, even with this breast lump, out of 10 people who think they have a lump, it is said that only 10% actually had breast cancer. In other words, breast cancer often has no early symptoms. So how can we detect it early? I will introduce this in the second half of the video, so please watch until the end if you are interested. It all started with a strange feeling, like my chest might be getting smaller. There is a video where Anna Umamaya talks openly about her battle with breast cancer, the painful chemotherapy, and the process that led to her decision to have a mastectomy. She shares her struggles with losing her hair, speaking honestly as a woman, a mother, and a model. It really touched my heart. If you are interested, please check the description or comments after watching this video. The risk of breast cancer is high in the second period. Let me explain the 4 main characteristics of people at high risk for breast cancer in an easy to understand way. Here are 4 characteristics of people who are at higher risk for breast cancer. The first one is people who have been exposed to female hormones for a long period of time. That alone might not be very clear. Most women have female hormones, but depending on how they've lived their lives, the period they've been exposed to female hormones can be almost twice as long for some people compared to others. There are 4 main characteristics related to this. People who started menstruating early, those who have never had children or had their first child at an older age, This includes people who have no history of breastfeeding their babies or only breastfed for a very short period, and those who use female hormone medications. Why are these people at higher risk? It's because women are exposed to female hormones from the time menstruation begins until menopause, but during pregnancy and breastfeeding, the hormone balance changes. So the amount of exposure to female hormones is reduced during those periods. If menstruation starts too early, the period of exposure to female hormones becomes longer, and people who haven't experienced breastfeeding are also exposed to female hormones for a longer time. The period of exposure becomes longer. Also, it is said that people who use female hormones for things like low-dose birth control pills or menopause treatment actually have a slightly increased risk of breast cancer. However, these low-dose pills and hormones used for menopause, female hormone medications in any case, many people use them because they have severe menstrual pain, excessive menstrual bleeding, want to control the timing of their period due to sports, or have really tough menopausal symptoms like excessive sweating, headache, numbness in the hands and feet, or depression. By using female hormone medications, their quality of life improves dramatically and they're able to do things they couldn't do before. There are many such benefits. However, on the other hand, there is data showing that it does increase the risk of breast cancer to some extent. So it's important to consult with your primary doctor, get an examination before starting, and have regular checkups while undergoing hormone therapy. That's very important, so make sure to understand it correctly and be appropriately cautious. Characteristics of people at high risk for breast cancer. 4 selections. The second one is people who are overweight. Being overweight and breast cancer, what kind of connection is there? I think many of you might be surprised. Actually, these fat cells from obesity play a very important role in producing female hormones. After women reach menopause, the amount of female hormones suddenly decreases. So, how are female hormones produced after that? Actually, the hormones that are made in the body, male hormones are converted by the fat in the body. Male hormones are converted into female hormones. That means after menopause, if you are obese and have a lot of fat, people who have a lot of fat tend to have higher levels of female hormones, so it is believed that they are more likely to develop breast cancer. Here are 4 characteristics of people at high risk for breast cancer. The third one is family history. I think this is well known. If you have a blood relative who has had breast cancer, there is data showing that your risk of breast cancer increases, so please be careful. Here are 4 characteristics of people at high risk for breast cancer. The fourth one is age. Do you know at what age breast cancer is most common? While many types of cancer tend to increase after the age of 60, breast cancer starts to increase in people in their 40s, and the peak is said to be in their 50s. If you know someone around you who has had breast cancer, please try to recall their age. A relatively large number of people are actually quite young, aren't they? Now, let's review the second lesson. I introduced 4 characteristics of people at high risk for breast cancer. The first one is being exposed to female hormones. People who have a longer period of exposure, such as those who started menstruating early, those who have never given birth, and those who had their first childbirth at an older age. People who have never breastfed, those who had a short period of breastfeeding, and those who are using female hormone medications. I have introduced these groups. As the second characteristic of people at high risk, I mentioned obesity. In fact, fat cells are believed to be the reason, as they convert male hormones into female hormones. Third, I mentioned having a family history, and fourth is age. The risk starts to increase in your 40s and peaks in your 50s. One of the characteristics of breast cancer is that it tends to occur at a relatively young age. So, based on this knowledge, what should people at particularly high risk do? How can it be detected early? What can be done to detect cancer at an early stage, even when there are no initial symptoms? The Ministry of Health, Labour and Welfare also recommends it, as it has reduced the mortality rate from breast cancer by as much as 32%. I will introduce the methods in 3 sections. Nowadays, both medical professionals and non-professionals are using various medical information is being shared by many people. At the medical university, we will provide easy to understand information based on data from a doctor's perspective, so I would be happy if you could subscribe to the channel. I will introduce methods to detect breast cancer early and reduce the mortality rate. At the end of the third part, I will introduce how you can reduce your risk of breast cancer, not only by relying on tests, but also through diet and exercise habits. Due to breast cancer, you can reduce the mortality rate by as much as 32%. The method. What is it? To give you the conclusion first, it's breast cancer screening. Some of you might be thinking, well, I already know about breast cancer screening. Have you ever had one? At what age should you start? How often should you get it done? Actually, compared to Western countries, Japan is behind when it comes to cancer screenings for women, such as breast cancer and cervical cancer screenings. The screening rate for these cancers is less than half. It's a very low rate, which is a characteristic of Japanese people. While many Western countries have rates over 80%, Japan's rate is only 35%. Only 1 out of 3 people actually get screened. That's the reality. According to research by the United States Preventive Services Task Force, women aged 50 to 59 who get breast cancer screenings have a 14% lower risk. For people aged 60 to 69, in other words, those in their 60s, it has been reported that the risk of breast cancer decreased by as much as 32%. There is similar data in Japan as well, and this breast cancer screening is actually called organized cancer screening, and it's a type of cancer screening promoted by the government, especially by municipalities. It's one of the cancer screenings. Once you turn 40, you can have this breast cancer screening every 2 years. What happens is, first, you have a brief interview that takes a few minutes to check if you have any symptoms or concerns, and the doctor examines you. Through visual and physical examination, they check if there are any changes in the shape or color of your breasts. And through palpation, they check for any lumps or swelling of the lymph nodes. Finally, they do an imaging test called a mammogram, where your breast is compressed and an X-ray is taken. By doing this, it's possible to detect breast cancer early, even if there are no symptoms. That's what a breast cancer screening is. At some hospitals, they also use ultrasound to perform an echo test. In fact, more cases of early-stage breast cancer are found through breast cancer screenings than through the initial symptoms I mentioned earlier. So I strongly encourage you to get screened for breast cancer. Please consider getting a breast cancer screening. Find out how you can get a breast cancer screening in your area. In some regions, there are subsidies available, so you can find this information by searching the website of your local government or municipality. Breast cancer. Some of you may have received information about the screening, but accidentally threw it away without realizing it. This is a review of the third period. I introduced breast cancer screening as a way to reduce the mortality rate from breast cancer. In Japan, once you turn 40, you can get a breast cancer screening every 2 years, which includes a medical interview and other procedures. And an X-ray called a mammography is taken. This is part of the screening. It's called population-based cancer screening, and it's promoted by the government. By doing it, you can definitely reduce your risk. Well, it's one of the few cancer screenings like that, so please consider it. Well then everyone, what you've all been waiting for. You now understand the symptoms and tests. I think what you're really interested in is how you can actually reduce your risk of breast cancer in your daily life. This time, based on data, I will introduce 5 lifestyle habits that may help lower your risk of breast cancer. 5 lifestyle habits to reduce the risk of breast cancer. The first one is this: reduce your alcohol consumption. There is a highly reliable study called a meta-analysis, which summarizes 110 clinical studies, and it has published data showing that even a small amount of alcohol consumption is related to an increased risk of breast cancer in women. According to a large-scale study comparing alcohol and breast cancer risk, people who do not drink alcohol and those who drink 3 to 6 drinks a week. When comparing people, it was found that those who drink have, on average, a 15% higher risk of breast cancer. There is also data showing that the more alcohol you consume, the higher your risk of breast cancer. For example, consuming 10 grams of pure alcohol per day, which is about 1/500 milliliter bottle of beer per day. There is data showing that such people have a 10% higher risk of breast cancer. So, it is said that people who drink 2 bottles have a 20% higher risk, and those who drink 3 bottles have a 30% higher risk. So even reducing your alcohol intake a little might help lower your risk of breast cancer. That's what the data shows. What you need to be careful about is, the data shows that people who drink alcohol have a higher risk of breast cancer, but it doesn't show that reducing alcohol actually decreases breast cancer cases. So we can't say for sure that cutting back will definitely lower your risk, but it's certain that drinking is a risk factor. So if you want to lower your risk even a little, you might want to consider reducing your alcohol intake or even quitting drinking altogether, lowering your risk of breast cancer. 5 lifestyle habits to reduce your risk. The second one is the Mediterranean diet. Are you all familiar with the Mediterranean diet? It's a diet centered around nuts, vegetables, olive oil, and mainly fish. It's a dietary habit of eating foods that are found along the Mediterranean coast. This kind of diet has also been shown to possibly reduce the risk of breast cancer. People between 60 and 80 years old. In a study involving 4,000 people, a diet that included extra virgin olive oil and mixed nuts, those who followed a Mediterranean diet had a lower incidence of breast cancer. There is data showing that their risk was reduced by as much as 68%. However, this is just one set of data, and it's possible that these people had mammography screenings or not. Such information isn't clear. So while the Mediterranean diet may have the potential to reduce risk, there isn't solid data yet, so it's still... If any new information comes out, I'd like to share it with you. To reduce the risk of breast cancer, lifestyle habits. The third one is exercise. I think it's surprising that exercising can also reduce the risk of cancer. In a highly reliable study that summarized 139 research papers, about 230,000 people with breast cancer and people without breast cancer, they compared a total of 4 million people. The data shows that those with higher physical activity had a 22% lower risk of breast cancer compared to those with lower activity. And this effect of exercise applies to both premenopausal and postmenopausal women, showing that the risk decreases for both groups. As for the intensity of exercise and how much effort you should put in, it is recommended to aim for about 7 metabolic equivalent of task S. What is 7 metabolic equivalent of task S? Metabolic equivalent of task S are a unit of measurement for exercise, and 1 metabolic equivalent of task is the amount of energy you use when you are sitting quietly in a chair. That's the amount of physical activity. So 7 times that would be, for example, light jogging, swimming, skiing or skating. Exercises that make you a little out of breath are about 7 mets. This kind of exercise is also effective for high blood pressure, diabetes and lipid disorders. It's said to be important from a prevention standpoint, so even if it's just once a week or even just for 30 minutes, please try to make a habit of doing a little exercise, as it may also help lower your risk of breast cancer. Lowering the risk of breast cancer. Lifestyle habits. Top 5. Here's the fourth one. A diet that reduces fat and includes plenty of vegetables. There's a very well-known study supporting this. There was a study that tracked 49,000 people, dividing them into those who ate a regular diet and those who ate a low-fat diet. That sounds like a huge undertaking. After tracking them for 8.5 years, those who reduced their fat intake, the people who were encouraged to eat a low-fat diet had more people who lost weight, and also, when they checked again 20 years later, it was reported that the people who worked hard to eat a low-fat diet had a 21% lower incidence of breast cancer. It's not that the risk of breast cancer decreased just because they lost weight and reduced fat. Even after adjusting for or ignoring the effect of weight, it seems that eating a low-fat diet itself reduced breast cancer. That's the kind of research result we have. If just reducing fat can lower the risk by 21%, I think this study is worth trying. While also referring to things like nuts and olive oil from the Mediterranean diet I mentioned earlier, I encourage you to try switching the oils in your meals to olive oil, or when you're a little hungry, try eating nuts instead of fried foods or chocolate. Even just doing things like that might make a difference. You might be able to reduce your risk of breast cancer. Lifestyle habits that can lower the risk of breast cancer. Top 5. Lastly, the fifth one is this. Losing weight. Gaining fat increases the risk of breast cancer. I talked about that in the second session. There was a study that followed 50,000 people for 24 years. According to the study, women who had never used hormone therapy and lost more than 10 kilograms had a 57% lower risk of breast cancer compared to women who did not. What do you think? Isn't it surprising that just by losing 10 kilograms, the risk was reduced by 50%? Of course, if your original weight was already appropriate. If someone who is already at an appropriate weight loses 10 kilograms, it could actually be dangerous and even life-threatening due to excessive weight loss. So it's not necessarily about trying hard to lose 10 kilograms. However, since I explained that obesity is a risk factor, making an effort to reach an appropriate weight could help reduce the risk of breast cancer. Now let's talk about how to reduce the risk. Let's review lifestyle habits. The first lifestyle habit to reduce risk that I introduced was alcohol. If you add one 500 milliliter bottle of beer per day, your risk increases by 10%. The second is the Mediterranean diet. It's centered around olive oil, nuts, fish, and dairy products. I mentioned that this way of eating may help lower the risk of breast cancer. The third is exercise. I mentioned that people who do activities like jogging or swimming where you get a little out of breath have a lower risk of breast cancer. And the fourth is a diet to reduce fat. I mentioned that there is a difference in breast cancer risk between people who follow a diet to reduce fat and those who do not. And finally, it's about body weight. If your weight is 10, people who lost 10 kilograms have a 50% 8% difference in risk compared to those who didn't. That's what I introduced to you. Now let's do a final review. In the first lesson, I introduced the 5 early symptoms of breast cancer that you'll regret not knowing: lumps, dimpling, abnormal nipple discharge, irregular menstruation, and lumps under the armpit. And as a self-check, make sure to examine your breasts once a month. I recommended making that a regular habit. In the second lesson, I talked about the characteristics of people who are more likely to get breast cancer: those who are exposed to female hormones for a long period, people who are overweight, those with a family history of breast cancer, and people in their 40s and 50s. In the third lesson, I explained that breast cancer often has no early symptoms, so cancer screenings are important to help lower your risk. That's what I talked about. It's a long video, but thank you so much for watching until the end. If you have any experiences with breast cancer, like this is what the doctor told me when I went to the hospital, or this is what happened when I got tested, please share them in the comments section. I would really appreciate it if you could share your experiences in the comments. About this video, I'd appreciate it if you could rate this video, whether it's a thumbs up or a thumbs down. It will help me with future videos. And if you found this video even a little bit helpful, subscribing to the channel would really motivate me to make more videos. Well then, see you next time. See you in the next video.